Members, today I have received within the prescribed time a matter of public interest from the Leader of the Opposition in the following terms: that this House condemns the Cook Labor government for its ongoing failures in the health system, including presiding over another record month of ambulance ramping and neglecting metropolitan health hospitals and regional health services. The matter appears to be in order, and if there are at least 5 members who will stand in support of the matter being discussed, and there are, the matter can proceed. The Leader of the Opposition.
Thank you, Mr Speaker. I indeed do move that this House condemns the Cook Labor government for its ongoing failures in the health system, including presiding, as you've said, over another record month of ambulance ramping and neglecting metropolitan hospitals and regional health services. The opposition is raising this issue as a matter of public interest because this government is presiding over a health crisis worsening month by month. The government and its 5 ministers for health are placing patients and frontline workers under unimaginable strain. And all the while, the Premier and the Treasurer keep talking up the Burswood racetrack, their pet project that is symbolic of this government's focus on wrong priorities. And again, I ask, what could that $217.5 million, the estimated total, what could that money do for our hospitals and health? It's not a laughing matter, Mr Speaker, as you know. We're talking about sick, dying and injured West Australians. And I will remind everybody opposite me that that is the subject for this MPI, the health failures under their watch. I wouldn't be laughing if I were members opposite. Now, today I was planning to address the mounting crisis in health and hospitals by coming up to speed with some of what has taken place in the public health space in the 2 weeks since we have been gone. I could talk about elective surgery, which during our 2-week absence continued to be delayed and postponed and putting immeasurable pressure on those family members who were given late notice of those delays. Could have talked about the crack squad that was highlighted during question time by one of the ministers, who actually asked during her response about health priorities. She looked our way and said, "What are you doing? What are you doing?" she said. Perhaps a momentary lapse in consciousness that actually the members opposite are in government. I could have talked about the winter surge plan and the revelation that it was finalised only 3 days before winter. 3 days before winter. I note also at the Premier's breakfast on Monday he said, "But don't worry, next year we're going to get the Health Minister to get onto it early." That's what he said. That's what he said. I could also have talked about a number of other concerns raised by doctors. One senior medic quoted as saying, "I would never ever imagine in my lifetime I would be watching healthcare, and for that matter, hospitals implode." There was another who said, "When you are down more than 1,000 beds through incompetent planning, blaming other politicians over in Canberra sounds very desperate." But I won't highlight all of those events which took place during the 2 weeks of our absence. I might, if it's okay, Mr Speaker, just highlight on 2 specific events that took place during our 2 weeks absence. One of those centres around the lead in the PCH hospital. And you will know, and all those in this House will know, that during the 2-week absence, 11 samples of drinking water at Perth Children's Hospital, taken between the start of 2023 and the end of March 2024, it was revealed contained more lead than the safe quantity under the Australian drinking water guidelines. And I might also note that no one thought that hospital workers, patients or families deserved to know. The AMA and the Nursing Federation, they thought completely differently. This, after all, is the Premier who in 2016, members, he said, and I quote, he said, "Lead in the water should strike fear into people's hearts." That's what the Premier, who was the then spokesperson for health in the opposition, said about lead in the water. I'll say it again. Lead in the water should strike fear into people's hearts. And then today, just before question time, a brief ministerial statement came our way from one of the 5 ministers for health. Some of the highlights of the brief ministerial statement included these words: "I acknowledge the concern headlines late last week have caused patients, parents and staff at the hospital." Of course, we're talking about the 6 in 2023, the 5 between January and April of 2024. And she then went on to say, "Late Friday afternoon, the 5th of September, the Department of Health advised my office that it had just learned of 5 further exceedances at PCH from its latest round of testing relating to 2 locations." That's right, we found out today, and so that led to me asking some questions during question time, exactly what we're here to do. That's what the opposition do, they ask questions of government ministers during question time. And I asked the Health Minister, when was the latest round of testing conducted? No answer to that. What is the level at which you consider exceedances would present to risk to patients or staff? No answer to that. And why were parents and staff not notified promptly on Friday, 5 September, of the 5 further exceedances at Perth Children's Hospital, which you announced today? There were the 3 questions. 3 questions, no answers. We're talking,
Member
of
for
course...
Central Wheatbelt, I can't actually hear the member for Churchlands because you're echoing and repeating so much of what he's saying. So.
We're talking, of course, about the same... We're talking, of course, about the same subject...
Member for Central Wheatbelt, are you challenging the Chair's commentary? Okay. Member for Central Wheatbelt.
Point of order, Acting Speaker.
Sit down. Everyone, member for Churchland, sit down. I asked in previous weeks that those on my left read the standing orders. And it's clear that some have not, from cover to cover, read those orders. I'd encourage everyone to go back and reread those orders, because it's not appropriate in this chamber to challenge the Speaker in that way, whether it's the actual Speaker or the Acting Speaker or the Deputy Speaker. Member for Churchlands, you have the call.
Point of order, Acting Speaker.
Member, what is the point of order?
The Leader of the Opposition is trying to deliver his speech, and you've got mumbling from a Cabinet Minister speaking to her colleagues in the background, and I would ask you actually to...
Member, sit down. That's not a point of order. Member for Churchlands.
Thank you, Acting Speaker. So, again, 3 questions to the Health Minister. 1 of 5 Health Ministers, no answers to those questions. But we did in there get a little thread that we could follow. And I'm sure those sitting on my side followed that thread. We did get from the Health Minister that, I know this isn't good, and lead in the water, as the Premier said back in 2016, should strike fear into the heart of West Australians. This isn't good. So what we're going to do, and what I've asked today to happen, is that if there's lead in the water detected anymore, what we're going to do is we're going to get the department to tell the Chief Health Officer, and then the Chief Health Officer has to let the Director-General know, and then the Director-General has to tell me, the Minister. This government is becoming famous for handballing the ball around. There's a merry-go-round of health ministers, and there is a merry-go-round of health excuses. Again, we heard the Minister say in question time, I've told... From now on, the department has to notify the Chief Health Officer, who has to notify the DG, who has to notify the Health Minister, but nothing in there about notifying patients or parents. Who's going to tell them that they are working in an environment where there are and is excessive amounts of lead? And for whatever reason, those opposite us don't think this is a serious matter. The brief ministerial statement from the Minister for Health went on to say the safety of our patients and staff remains of utmost importance to our government. So why not tell them when, as the Premier said back in 2016, lead in the water should strike fear into the heart of West Australians? Why not tell those patients, their staff, why not tell those patients, their parents and the staff that there has been lead detected in the water? Now, I do feel a little bit for the Health Minister. She's one of 5 Health Ministers. She was absolutely dropped into this portfolio. Dropped into this portfolio. Nobody else wanted it. None of the more experienced colleagues were prepared to take it on. So the first-time minister had to accept responsibility for the health portfolio. And I can understand the Health Minister being a little frazzled, a little frustrated, a little flat. I get it. I get it. It is a difficult portfolio, and whenever there are questions asked of the senior leadership, the ball gets handballed around and around and around that merry-go-round. But let's be clear. If there is lead in the water at PCH, the least the minister should do is answer those questions. When was the latest round of testing conducted? What is the level at which you consider exceedances would present a risk to patients and staff? And why were parents and staff not notified promptly? And instead of being told that the department has to notify the Chief Health Officer, who has to notify the DG, who needs to notify me, the Minister, what about letting us know when the patients, when their parents and when the staff at PCH are going to be notified? Now, of course, the other event during our 2-week absence, there were many, but the other event during our 2-week absence was another record round of ambulance ramping. It almost beggars belief that after a new Western Australian all-time record for the month of July, the month of August went past it, and a new record. 7,074 hours, equal to 295 days' worth of ambulances parked outside WA hospitals, not responding to 000 calls, and patients in hospital corridors and outside emergency departments waiting to be seen. Again, August followed July at 7,014 hours. That's the equivalent of 292 days. All the while, this government persists with its pet projects. And we hear from the Premier, the man ultimately in charge of this merry-go-round of health ministers, when presented with the new record numbers of ramping for the month of August. Members, did he say sorry? No. Did he accept responsibility? No. Did he offer solutions? No. Did he say, here's what we're going to do? No. Did he say we're going to drop that racetrack, which clearly is a bad idea given it's worth $217 million and it could go straight into hospitals? No, he didn't. Do you want to know what our Premier, the leader of Western Australia, do you want to know what his response to the new record ambulance ramping numbers was? I'll tell you what it was. You would not and could not believe this. My daughter told me this and I said, don't make stuff up, Ava. I went back and looked at the tape and this is what the Premier said. I sat up last night, I googled South Australia ramping. You see headlines, crisis, record numbers of ramping. So the Premier, instead of putting his hand up and accepting responsibility, instead of saying this is not good enough, instead of saying we're sorry that we've let the people of Western Australia down, instead of saying we're going to cancel the racetrack, which even one of our own has pointed out to everybody is not wanted, not required, not needed and should not proceed, I'm going to blame others. Well, I'm pleased. I'm really pleased that the Premier, our leader, someone who should know better, took us down the Google path, because I thought I might Google ramping in other jurisdictions as well. And it's incredible that just by crossing one state border, the first one we come to is South Australia. And guess what they've got over there? They've got a Labor government. And guess what also they have? They have a South Australian Labor Premier. He too is struggling with ambulance ramping in Adelaide and South Australia. And it was put to him, you haven't been able to bring this under control. And do you know what the South Australian Labor Premier said? He didn't wave his arms around.
Did he Google?
He didn't Google.
Member for Cottesloe.
Here's what he said.
Central Wheat Belt.
He said, in terms of fixing the ramping crisis, and Premier, Premier, you could do well to listen to your South Australian counterpart. You could do well to Google his response to ambulance ramping in South Australia. You could do well to look up what real leadership looks like, because this is what he said, Premier. The Premier of South Australia said, in terms of fixing the ramping crisis, of course we'd like better results. I'm not going to shy away from that. That would be unfair and not responsible. We would have liked far better results in respect of ramping, particularly given how much resources and capacity we've thrown into the system. I can't deny that for a second. And asked Premier if it was a broken election promise, the South Australian Premier, the South Australian Labor Premier said, well, certainly people will characterise it that way. And I've got to accept that criticism. That's the honest approach. Very honest. They are the words of the South Australian Labor Premier in response to his state struggles with ambulance ramping. So, Premier, I say to you, you can deflect, you can deny, you can duck and dive all you like. But what the people of Western Australia would really like you to start doing is to say sorry and to start fixing these problems. No excuses, not passing the buck, not the handball game that you've become famous for, and certainly not a $217.5 million racetrack where those funds would so urgently make a difference in health and hospitals. It's time for solutions. It is time to fix it. It is time to dedicate yourself to this most urgent problem on behalf of West Australians around the state. Because, Premier, you have let the people of Western Australia down. Your attitude is not befitting the leader that we would expect here in Western Australia. It is time for leadership. It is time for empathy. It is time for you to take responsibility. Axe the track, Premier, and fix our hospitals. Yeah.